Hello, I'm excited to be here with you today. My name is Lynn Thoma. I'm the Director of Pharmacy here at HealthLink. I've also been very involved with the vaccination planning throughout our organization since it started here, I think sometime mid-January. I'm here today with my students, Emily and Hannah, and we're gonna do a little Q&A on the vaccine in pregnancy so we can hopefully answer some questions for you guys today.
Okay, so should you receive the COVID-19 vaccine if you are pregnant?
My off-the-cuff answer is yes, and let me tell you why. So the vaccine has not been studied in pregnancy, but from what we know about the technology of the vaccine and how it works, it is safe for pregnant patients. And if you go and look at guidelines from the CDC or ACIP, which is the governing body for immunizations across the country, or some of the guidelines from OBs, then you'll find that they say to not withhold the vaccine from pregnant patients. And a lot of those guidelines are even going to encourage pregnant patients to get the vaccine. And there's a couple of reasons why. One is because being pregnant is a risk factor for COVID. People that get COVID and are pregnant tend to have a worse side effect profile. So we want to make sure that we're protecting our pregnant patient population against COVID. So if it were me, if I were pregnant, I would definitely get the vaccine. And I understand that that's an easy decision for me. I understand that it might not be easy for everybody. So if you are pregnant and have questions about getting the vaccine, talk to your OB. We at HealthLink here would be happy to answer questions for you. But just utilize your resources and make an educated decision about getting the vaccine. I personally would be happy to talk to you.
Okay, and what if I'm trying to conceive? Should I get the vaccine then?
Yes, absolutely yes. So there is nothing to say that the vaccine affects fertility in any way. So if you're gonna get pregnant, you wanna be as healthy as you could be, right? So we would certainly encourage people that are trying to get pregnant to get the vaccine. Sometimes long-term side effects get brought up when we're having this discussion. And what I'll say about that is we know that there's definitely long-term side effects from having COVID. We don't necessarily know if there's gonna be long-term side effects from the vaccine. Like I said a while ago, what we know right now is the vaccine is safe. We don't expect it to have any long-term side effects, but we do know that you'll have long-term side effects from COVID. We just had a discussion a while ago that, with the vaccine, you might have a sore arm for a couple of days, but with COVID, you might not get your taste or smell back for 1 month, 3 months, who knows how long.
If I'm breastfeeding, should I get the vaccine?
Absolutely. So anybody who's breastfeeding can certainly receive the vaccine. Again, the way that the vaccine works is safe for people that are breastfeeding. And then we're not sure if some of those protective antibodies are passed on to the baby or not, but if they are, that's another great benefit to get the vaccine because you're not only protecting yourself, but you're also protecting your baby.
And how soon after giving birth should I get the vaccine?
As soon as you can get to somewhere that'll give you the vaccine, and it's convenient for you to do that. I don't want to say convenient because that's not necessarily true. As soon as you can get somewhere where you can get the vaccine, and that opportunity presents itself. So there's nothing to say that you should wait 1 day or 5 days or 5 months. As soon as you can get somewhere to get the vaccine after giving birth, please do that. Get the vaccine and get protected.
So I've heard that getting the vaccine, you can have some side effects. So if I'm pregnant, will I have more side effects from the vaccine?
Great question. No, being pregnant does not mean that you'll have more side effects, but I'll just talk about side effects in general. So it's a whole spectrum. Some people have no side effects, some people have a sore arm, and then some people experience those more systemic reactions like fatigue and nausea, but those only last 1 to 2 days. So let's just compare that to having COVID, and another great benefit to getting the vaccine is that those side effects are only gonna last 24 to 48 hours. Good job.